Section 8. End cycle. The lamp will beep once when 3 minutes are remaining and again 3 times on the final 3 seconds of the cycle, with one long beep when the time reaches 0. The light will automatically turn off when the cycle is complete. Remove the light guide from the retractor. Gently pull the lamp away from the patient while maintaining the vertical position. Carefully remove the gel with suction and/or wipe the surface of the enamel clean with damp gauze. Take care not to dislodge the isolation materials. Do not irrigate. The force of the water may pull the dam loose and saturate the isolation materials. Check the isolation materials to ensure they are intact and no pink is visible. If the patient notes sensitivity at the margin due to tissue oxidation, open the vitamin E oil and use the brush to apply the oil to the sensitive area. The vitamin E will help to soothe the tissue and act as a barrier against further gel contamination. The vitamin E oil may be applied to any tissue that has had contact with the whitening gel and may be sensitive or has turned white from the oxidation. Apply the starter swab to the top and bottom arches as before. Bleed the syringe to remove the oxygenated gel and ensure a fresh mix. Extrude the fresh gel into a dappen dish and apply as before with the enclosed brush. Use horizontal movement to reposition the light. At the beginning of each session, note that the number of sessions remaining has been reduced. Attach the light guide to the retractor and press the start button to activate the timer. Repeat these steps for each session to complete the whitening procedure. Section 9. Isolation removal and post-treatment. Remove the light guide from the slots and gently pull the lamp from the patient. Slide the lamp out of the way. Suction or wipe the gel from the teeth. Use damp gauze to remove the residual gel. Use the cotton pliers to grasp the gauze isolation and gently pull. All of the isolation material should pull free from the mouth in one unit. The retractor should remain in place. If the gauze is excessively dry, moisten it lightly before removal. Completely rinse the teeth and irrigate the oral cavity. If liquidam remains interproximally, remove with floss. Lightly use air to remove remaining material. Now it is time to judge the initial whitening results. With the retractor still in place, use the shade guide to determine the after shade. Document in the patient's chart and with a photograph. Review the post-treatment care instructions with the patient and provide the card included in the kit for reference. Explain to the patient that the teeth are more susceptible to restaining over the next 24 to 48 hours. The teeth may continue to lighten during this period, and the patient must be careful not to consume any staining foods or beverages. Syringe the satin finish potassium nitrate and sodium fluoride gel into the completed take-home trays and seat them on the patient. We recommend a minimum initial wear time of 10 to 15 minutes. A complete application requires approximately half of one syringe. If the trays are not ready, syringe the satin finish directly onto the teeth. Dispense the take-home whitening gel for maintenance care to the patient. The remaining satin finish gel or a desensitizing product such as Relief ACP can also be dispensed to the patient at this time. Section 10. Cleaning and storage. Use any standard quaternary ammonium phenolic-based disinfectant or alcohol to wipe down your ZOOM lamp. Do not spray disinfecting agents directly onto the unit. Do not use glutaraldehyde to clean your lamp. Such materials can damage the coating surface. When the lamp is off, prior to the next ZOOM appointment, check the glass in the aperture to ensure no residue from the cleaning fluid remains. Position the lamp comfortably for storage in your office. Section 11. Troubleshooting. The light will not turn on if the light guide is not in place. The display will continue to read Attach Guide. Use of the light guide is mandatory to maintain proper distance to the light and maintain positioning at the smile zone. Always cure the liquid dam in a sweeping motion. If the light is held in one position too long, the material can heat up, causing discomfort to the patient. Curing in a sweeping motion allows for proper cooling of the material. Once the isolation is complete, always check the margins and interproximal coverage of the liquidam, especially on your blind side. Remember, no pink. Use the vitamin E oil to soothe any sensitive or blanched tissue from contact with the whitening gel. If the vitamin E is applied at the margin after the first session, place an additional application of oil between the second and third session to ensure the barrier remains intact. If there is a concern about excessive sensitivity and ibuprofen is needed, do not exceed 1,200 milligrams within a 24-hour period. The smallest effective dose should be used. Consult a doctor for full prescribing information, warnings, and cautions. Stronger pain medication can be prescribed if needed. Post-procedure, the bleach trays can be used to deliver additional satin finish or relief ACP gel to the patient. The ZOOM whitening gels are packaged separately from the treatment kits. To enhance shelf life, when stored, refrigerate the syringes. The gel must be returned to room temperature for use, or it may be runny. This can be done by either leaving the syringe out overnight prior to the appointment, or placing the syringe in a cup of hot tap water for 10 minutes. Remove the syringe from the water and wait an additional 5 minutes before use. Please check the Discus Dental website or contact your sales representative for additional copies of these and other reference materials and forms. Marketing. Now that you've completed this ZOOM training, you're ready to let existing and new patients know they can have a brighter, whiter smile in less than an hour. For more information about marketing ZOOM to current and potential patients, call your sales representative.